Now, this short video is only for the classification of COVID-19 illness, whether mild or moderate or severe, how to label. Now, it's very simple. Uh, when we call this as mild COVID-19 illness, if definitely there is RT-PCR positivity with COVID-19 or an antigen COVID-19 positivity, and those patients who don't have shortness of breath or don't have hypoxemia. So no hypoxia, no shortness of breath, and other symptoms like cough, cold, weakness, tiredness, exhaustedness, lethargy, body pain, headache. These all symptoms can be present. So absence of shortness of breath or respiratory rate of less than 24 and normal saturation or saturation above 95% can be labeled as mild COVID-19 illness. Now we label it as moderate COVID-19 illness if patient fulfills at least any one of the two criteria. First, the respiratory rate has to be more than or equal to 24. If the RR is more than 24 or is equal to 24, and if the patient has shortness of breath, obviously, or if the saturation of the patient is 90 to 93% on room air. If one of these two criteria is fulfilled, we can directly label that patient has moderate COVID-19 pneumonia or moderate COVID-19 illness. Because saturation, if it is 90 to 93, it means that there is automatically involvement of the lungs. Without involvement of the lung, without lung pneumonia, saturation cannot be dropped. So, if saturation is between 90 to 93, it directly means that the patient has COVID-19 pneumonia and there is significant involvement of bilateral lung fields. We label it as severe COVID-19 disease if patient fulfills any one of the two criteria. First one is the respiratory rate has to be more than or equal to 30 per minute, or the saturation on room air has to be less than or equal to 90%. So if it is less than 90%, or if the patient's respiratory rate is 30, more than 30, it means the patient's lung involvement is significantly there, and we can directly label that the patient has COVID-19 illness. Now, this classification is as per January 23, 2023, as per Government of India. Thank you.